someone had filled her so much that she looked alien-esque, where the face just doesn't look human. So I ended up doing a revision facelift, and now she looks beautiful. She's just, it's so much more natural. It's amazing because now she looks in the mirror and says, oh my gosh, how did I walk around like this? This topic is kind of everywhere right now, and it's called filler fatigue. And if you've noticed, those overfilled cheeks or ultra puff lips are slowly fading away from, all of media. There is a reason behind it, and we'll kind of show how this big shift and how people are approaching injectables is really dictating how plastic surgery is heading into the future.
It's interesting because filler fatigue can have two different connotations. One is that, other people are tired of looking at you overfilled. I'm being truly just funny. But really what it is either they've done everything and you can't do anymore. So we're at a loss of putting in more filler, or the person's over it. So it's a combination of, is it you're fatigued from the practitioner side or from the patient side? It's really important to see that because there are a lot of people out there that are pushing the fact that fillers are bad. And that's not the case either. It just has to be done properly. So
yeah, I think there's a right way and wrong way of doing it. We see that. I mean, look, once you start looking unnatural, it's a wrong way of doing it.
Yes.
And so the goal, but really, when you tackle filler fatigue, for some injectors, they feel that if a little is good, a lot is better, and that's never the case. There is that margin of diminishing returns where you can only fill to the point where it's been lost. And when you overfill, unless you're trying to change someone's facial shape.
But think about this, John. What if it's because we've never been injectors? Meaning that's not our sole job, right? So what we do, we're plastic surgeons, and at the same time, we play with needles as well. Because
you're right. When you hit that plateau, you can move on to surgery.
Exactly. So if someone needs a facelift or bleph or anything else, you can do it. So it makes a big difference. But if it's like the old adage of everything is a nail if you have a hammer in your hand, right? So here's the question: if you are a injector and all you have is filler and Botox, well, you're going to continually chase by putting more in.
Right.
And I think that's where we're having problems because there are med spas at every corner.
Right.
And some people don't want to take that step and walk into a plastic surgeon's office and be like, hey,
or they're not educated on it.
That's it.
I think it's more, it's a combo. But I do think that there's a whole subset of patients that come in and someone tells them, hey, don't worry about it. I'll take care of it with non-invasively or minimally invasively. And that's not the case if you want to look normal. I had a woman that came to me, lovely lady, powerful businesswoman, and she was in her 60s, maybe almost 70. And someone had filled, she'd already had a facelift, but someone had filled her so much that she looked alien-esque. It really was an overfilling.
Absolutely.
And so I ended up, and the whole reason for it was she said, look, I already had a facelift years ago, and this injector told me, you don't need another facelift. I'll just take care of it with volume. I always say the same thing. I'm like, you can take any raisin and try injecting it all you want. It's not going to turn into a grape. The whole idea behind volumizing is to make up for what's being lost.
Yes.
The moment you overdo it, it starts looking, again, alien-esque, where the face just doesn't look human. So I ended up taking her back, removing the product, and doing a revision facelift, and now she looks beautiful. She's just, it's so much more natural. And it's amazing because now she looks in the mirror and says, oh my God, looks at old photos and says, oh my gosh, how did I walk around like this? They don't see it because you have an injector telling them, don't worry, you're going to look just fine. We'll just inflate here, and here.
Because they're just also trying to make money.
Right.
Which is interesting because that's the wrong way to do it, because ultimately that's why we are in this incredibly sizzlingly hot topic in 2025. called filler fatigue.
Right.
Because what's happened is med spas everywhere are just blowing people's faces up until somebody turns around and goes, whoa, what is going on with your face?
Right.
Now, most people don't do that unless you're like, 3.5, like my daughter that looks at you and says, whatever your face, Dad. Because most people aren't that honest and they just let it go. But then behind, they're like, oh my God, look at that lady.
Right.
So, why is this topic such a big topic now? 2025. It wasn't like this in 2015 when we first started, even though we didn't first start in 2015, but when we were cooking, why? Because people are doing more facelifts, because there's more social media.
Right.
Why?
We're finding more natural ways to achieve certain things, right? And the whole goal was, look, back in the 90s and 2000s, everybody went big, overdone, whatever it was, whether it was breast implants, whether it was butt implant, all kinds of things, right? And then there are certain aspects, even of the last 10 years, where we look at, fat injections to the butt, the Brazilian butt lift. Everybody was kind of overdoing these things. And what did we learn? Anything that was overfilled stretched out the skin and eventually falls. Gravity will always win. You lose collagen 1% per year after age 18.
Or even moved, right? Or migrated, especially in the face, because it's not a huge area. So if you put a ton of filler in, it's going to move in areas. And then you're going to say, whoa, what is that little irregularity? Or, right? There's so many things that can happen.
Well, now we realize that, again, there is a limit to what you can fill. And then after that, don't chase it. So whether you have a combo skin tightening procedure with your filler, it's a little different ballgame then, right? But eventually you hit a plateau where it's just not going to work anymore. And that's when surgery, and you need someone who reliably has the training or education that can educate you on the options. And that way you don't overdo it.
For sure. And it's interesting because what I've seen over the last couple of years is we're dissolving a lot more. Constantly dissolving filler. Number two, I'm seeing different alternatives for filler, like, for example, Skin Vive or Profilo, skin hydrators, not volumizers, but hydrators to make the skin better. Yep. The third thing is using things like PRF, using your own blood mixed with a proprietary gel to get a more natural
platelet-rich
appearance.
plasma or platelet-rich fibrin. These are different alternatives. It's like the natural way of...
Absolutely. Instead of just filling, like people would come and they'd have this shelf under their eyes with filler, and then they'd have the Tyndall effect, and they'd say, why does it look so blue under my eyes? And it was just because, again, people were like, put a needle in, blow it up, and this is how it's going to get. And instead, I think we're realizing there are alternatives to it. And I think also the one huge difference is we're realizing how important the skin is. Yeah. Meaning stretching out the skin is going to have its own detrimental effects, but also the outer shell, meaning what the skin looks like, is probably more important than anything else. Right. So proper skincare, whether it's with lasers, whether it's with Morpheus, whether it's just prevention or doing spot therapy or using tretinoin or chemical peels, anything to make the skin look better. People ask about Lindsay Lohan. I don't think it's the facelift that looks that great. I think it's the skin quality that looks really amazing.
Yeah. Look,
it looks amazing.
It's what you see. There's no doubt.
It's that skin quality. Anyways, I keep going on tangents, but let's keep talking about the difference between more filler, smart filler, and what really turns into that fatigued face where it looks like, man, she must be stuck with 100 needles.
Yeah, I think, the shift, even with the Gen Zers that are coming in that want to look more authentic, it's definitely, we have to change as surgeons to try to adapt. And it's always a good thing. I think you and I have always loved the natural look, right? But it's less about more filler, and it's more about smart filler, right? And alternatives to these things. And you had mentioned it too, PRP, PRF, stem cell exosome, all kinds of things, fat transfer. And now we had an episode on alloclay, which is the new substitute, fat substitute, it's cadaveric fat. But these are more natural sort of things. I'll put that in quotations.
But people are always concerned about, I can't do a chemical peel, or I can't do a fractionated CO2 laser. The downtime is too much. Well, guess what? Now it's not. We've got exosomes and stem cells that you can coat on your face and makes the downtime significantly less. I think the downtime from puffing up the face is a lot more because it takes forever for it to go down, if it ever even does.
Yeah, you know what? Especially, this is where we ran into issues over the last few years. It's under eye filler. It disrupts the lymphatics. The eyes get puffy, abnormal. Everybody's trying to fill in that hollowing in the under eyes. Sometimes I have patients that come to me and say my under eyes are hollow, and you look at eye bags and say, no, it's not that you have eye hollowing. It's that the tear trough has a very rigid sort of ligamentous attachment, and that needs to be released. There are much more natural ways of dealing with this, right?
Sure.
But you have to be educated on it. So, when you fill and overfill, for those of you out there that know about this, it's virtually impossible sometimes to get rid of some of that filler that's trapped in the under eye region. It's almost impossible.
Oh yeah, I agree.
And
it's a shame, because you know what it is, and I hear this regularly every day in our offices. Doc, I trust you. You do what you want, right? And I get it. You want to trust your practitioner.
Right.
You want to trust whoever you're going to. How often do you go to a dentist and see what they're doing? Never. You open your mouth, they do what they need to do, and you leave. Well, it should be the same when you're getting injected. You should trust your injector. Problem is, sometimes you're trusting your injector and you're coming out and you're going, oh boy. And then you want to trust the process and keep trusting the process, but you continually look more blown up and you look like a distorted person.
My recommendation for these, again, when we're talking about smart filler, is when a practitioner is recommending, multiple syringes. The idea is that you have them have you look in a mirror after each syringe. Because some people will say, you know what, that's enough for me. If you're blinded to the fact and you wake up and you've got 4 or 5, not wake up, but you're finished with the procedure and you've got 4 or 5 syringes in your face and you say, is this supposed to look like this? So my recommendation would be just follow, sequentially after each syringe and say, okay, yeah, here we go. I need a little more right here. I need a little more right here, because you know what you want to look like too. I mean, some people don't. Some people say, hey, look, do what you can. But, some people come in more often than not, I'm saying, and they're like, look, I'm deflated here. What are your thoughts about this? I need to add some filler. And so I'll kind of treat slowly. And even if I have to have them come back a few weeks later to do the rest, I would much rather do that.
Again, we've been in practice for almost 16 years. I don't think I have ever in my life put in 5 syringes of filler into anyone's face. Yeah. But that's sometimes commonplace for some people. And that's something that you need to really be, again, I think that's a great idea. 1 syringe at a time, take a look in the mirror. You see the effects of filler immediately. It's not something that needs to. You're not going to see it deflate over the next week or two. So what you see is what you get pretty much on the table, unless you're getting Sculptra.
Yeah, and I think that if a practitioner is pushing more syringes, it's kind of a red flag. The idea should be this. You start off slowly, and then you can see in the mirror and say, look, I need more volume here. Or if the practitioner shows you and says, look, you would benefit from this, and it makes sense to you. If they're just pushing filler to push filler, you'll see it. I mean, if there's no hollowing where they say there's hollowing, then, don't get the filler. You definitely have to speak up. Patients sometimes feel pressured into doing something by the practitioner. Don't allow that to happen. That you do have control.
So for the patients that are feeling filler fatigue, whether they feel like they're overinflated, or whether they feel like their skin's sagging, or whether they feel like they have contour irregularities, or they just feel like they're botched. Let's just take it that way. What are the alternatives? Because there have to be alternatives other than surgery. Let's start with that, and then we can talk about surgery.
Right. So, look, it depends on where it is in the face. So my thought is, for thin-skinned areas, I would use something like PRF, platelet-rich fibrin. And it's a process where you draw your blood, and it goes through a proprietary gel, and The fibrin products as well as the platelet-rich area is injected into usually the under eyes. Sometimes you can use it on the neck, thinner-skinned areas. When we start talking about adding more volume, that's when I would switch over to, using your own fat. And if you don't have fat, that's you can use one of the alternatives. But I would say, again, it's a difference between volume versus a light fill with improvement in skin quality.
We've always preached this since we started practice. Fat transfer is the gold standard for volumization. Mm-hmm. It really is. The difference is a nurse injector or a med spa has zero ability to give you fat transfer. So they're stuck and they can't even give you that option.
Right.
You have to understand. Yes, I find that to be by far the best treatment. But there are fillers that can do the right thing if you just are very conservative. Now, and the other reason that I love fat transfer is because it's got stem cells in it, and it can actually help skin quality. It can help other issues, sometimes acne scarring. We can go on and on and on. And we've done many episodes on fat transfer. So look those up, please. But when is it time for the person to say, okay, I'm hanging them up, open it up, cut me, fix me, make my face look. Because again, the other trend nowadays is facelifts at a younger age. So
we have that episode as well.
When is it time where you're just like, okay, stop putting filler in your face? Is there certain signs you see on someone's face where you're like, this is just not going to do anything?
Well, here, let me take a step back further. So, I alluded to it earlier. After age 18, we lose 1% of collagen per year. So now, how old are you when you lose 10%? 28. How old are you when you lose 20% of your collagen? 38. Mm-hmm. I think at 38, if you're going to get filler, phenomenal, but you got to do some skin tightening, collagen stimulating with it. Because to just fill adds weight, which means gravity is going to take over. So you have to do something to stimulate collagen to try to prevent that from happening. Once you start getting into your 40s, when we've got volume loss and a significant amount. So remember, by the time you're 43, imagine you've got 25% of collagen loss. Pretty soon, again, if you don't do anything, you will look your age or older.
Absolutely.
And so that's when you start thinking, let's say by 45, the new trend is, okay, I'm going to have a mini facelift, or I'm going to have some type of lift or something like that, because you have more collagen then than you will when you're 60. So you could get away with doing, let's say you have a little bit of a saggy neck and the brow's falling a little and the face is okay, but you'd love a refresher. Then you do what's called a temporal lift, where it's the incision hidden back in the hairline, and you can actually lift the tail of the brow and the lateral aspect of the face, and then do a neck with, hidden incisions behind the ear. And it's almost like getting a full facelift at a younger age, but you get the effects of it.
What I find to be the most fascinating out of all of it is people think that by doing it at a younger age, it's taboo or it's not good. In my opinion, it's better because you're not making that dramatic transformation.
Right.
The signs of aging at a younger age are much less than they are at an older age.
Very true.
Healing is going to be that much faster.
That's true. You look, anytime I do a facelift on a 45-year-old, and you do, they look refreshed, like you just rewound the clock. When you're 60, a lot of those lines are permanently embedded into the skin. It'll never be. Look, can we make it look natural? Yes, you can, but sometimes it's night and day between someone doing it in their late 40s as opposed to in your 60s. And so the thought is, the younger and younger you do it, if you have that ability, one, you get to enjoy it at a younger age, and two, it tends to be not such a drastic change. It can look, much more natural.
And remember, guys, there's certain things that fillers just aren't going to fix. Like if you come in and you've got significant jowling and neck skin laxity and platysmal bands, and guys, understand, there's just only so much some volume can do. So if you really try to build the jawline, all it's going to do is just make you really just have just volume in that area. You
Yeah,
can't
listen,
fix
I was
this.
going to
It's
say,
just
for
impossible.
those people who start developing jowls, I know one of the common things that an injector will do is try to fill in the little crease. We call them labiomental creases or marionette lines.
impossible.
But what you actually do, will it make it smooth? Yes, it will, but it makes the lower face heavier. And you never looked that way when you were younger. So who cares if the contour is now flat if you look more masculine? It
So
just
true.
that doesn't help.
So true.
My thought is this, in our closing arguments, Your Honor, what I would say is, if you are going to get filler, make sure you got a mirror in your hand. After each syringe, you are constantly assessing, so no one is pressuring you or pushing you, to do something that you don't want. Second, if they are going to say, hey, you do need more filler here, here, and here, make sure that you see what they see.
Right.
Because if you don't, you're just wasting your money. It has to be something that bothers you, or they point out and you say, oh, I didn't notice that. Yes, please add some volume there. It's a different ballgame. Once you're in your late 30s, early 40s, if you are going to get some filler, I would also consider some type of skin tightening procedure, such as microneedling or a chemical peel or a little bit of laser, something like that, because you've already lost a significant amount of your own collagen. And then when you're in your mid 40s upward, look, there is a limit to what filler can do. If you want a nice refresh, that's when we start delving into surgery. That's my take on it.
Now, we've got some listener questions to wrap it up. So I'm going to kind of throw these out at you and I'll have you answer them.
All right.
First one is, how do I know if I have too much filler?
Well, I think when that happens, one, you don't recognize yourself. That's usually when it's too late. Two is when family starts getting concerned and they look at you and say, look, you may want to slow it down on the filler or procedures because you're starting to look a little fake, right? Anyone who makes that comment, it should at least raise awareness that you're on the edge.
Okay, so the next question is, are there fillers that don't cause fatigue?
The part of it that causes fatigue, I think, is the over-volumization, right? And so can you use some more natural things? Listen, there is Sculptra for those thin individuals that is essentially the powdered form of our absorbable stitches, and it stimulates collagen, but it takes multiple sessions. It's over time. The second would be when we use some of the natural products like your own blood, PRP, PRF, those things. And then fat, I think, is phenomenal.
Another question just following up on that is someone asked, can fat transfer be done without having surgery, without going to sleep?
Yeah, you can do fat transfer under local. You have to imagine we numb up the area for the belly or the inner thigh or something like that where we harvest. So you don't really feel it. And then afterwards, it's just like you're getting fillers in the face. We just use a cannula. It would be the equivalent of a blunt tip 18 gauge needle, which is a larger needle, but it's still just a little puncture wound that you inject the area with anesthetic so you never feel it.
Again, a follow-up to that is, how long does fat... So really quick, just so everybody understands, how long does fat last in the face?
We say 5 to 10 years with a potential permanent component.
How long does a biostimulant like Sculptra last in the face?
18 months.
And how long do average fillers last in the face that are hyaluronic acid?
Anywhere from 6 to 12 months.
So those are good things to kind of put in the back of your mind too as well. There is this kind of lattice framework that is there with the fillers. They don't always completely go away. There's some there. So you can build on it. And here's the last question from the audience and our viewers. Can I reverse filler fatigue without having surgery?
Well, yeah, you can deflate with hyaluronidase. Has its own set of complications because hyaluronidase not only eats up filler, but if it's concentrated, it'll eat up your own tissue too. So it has to be diluted, which means you would much rather go back multiple times than try to get it all removed in one sitting because that can destroy skin and everything else. So,
Absolutely.
But it can.
And then on top of that, you can do some non-surgical stuff like skin tightening, and peels. And again, guys, concentrate on that skin. I think skin rejuvenation is as important as filling everything up.
Definitely.
This has been an awesome conversation. Thank you, everyone, for all of your questions. And I think filler fatigue is real. And what we really need to do is the key takeaway today should be prioritize quality over quantity.
Boom.
Work with a board certified provider. I would say a plastic surgeon or a dermatologist, because we have the most experience injecting fillers. The fillers, all the studies were done through plastic surgeons and dermatologists, not an ER doctor, not an internal medicine doctor. With all due respect, I love all the doctors in this world, but I think everyone should stay in their lane.
Right.
And, focus on what makes you confident in your skin, not what the person is telling you.
Right. If you like this video, you're going to love this one.
Anyone who needs volume anywhere, for hip dips, for Brazilian butt lift, for extra volume. So this is anything to add volume, but in a more natural way without having to harvest fat.